Today's education is going to review the neuromuscular transmission module, NMT or train of 4, with utilization with the GE monitor. To start with the NMT for the GE module, you will have to get your NMT tram and also your NMT cord, which then at that time you would select which NMT cable that you would like to utilize. You will either utilize the electrodes or the mechanosensor. For the train of 4, we're going to start off with the mechanosensor. Before we review that, the baseline train of 4 is a response that is needed prior to initiating any paralytic drips. This ensures there's reliable measurement is achieved when the medication is present, and it allows the RN to know if the patient is appropriately paralyzed. For a patient who's receiving a paralytic and goes onto comfort care, the patient cannot be placed on comfort care until they are no longer paralyzed. So eliciting a train of 4 back to a normal response is very important for these patients. If a patient has any kind of neuromuscular disorder, such as MS, the initial baseline assessment may have a lower response. So for NMT or for train of 4, we use this before we utilize a neuromuscular blocking agent. So our NMBA are utilized to ensure that the patient is not too paralyzed. And with train of 4, it is going to give 4 shocks, and the patient should give back 4 responses or the 4 twitches. So as you can see with my site, before you would place on your electrodes, you want to make sure that your skin is prepped for better contact. So you want to make sure your skin is prepped with alcohol, soap and water, or ChloraPrep. After the site is cleansed, allow that site to dry. If there's any hair, remove that gently and then prep your site. If there's any breaks in the skin, do not apply those electrodes to that site, and we will review the other electrode lead portion. So in a pinch, you're able to use the telesensors, but when using the NMT for the GE monitor, or if you are utilizing the electrodes for the GE monitor, you want to make sure that you are using the appropriate electrodes at all times. Again, if you're in a pinch, you are able to use these telesensors. Just make sure that the electrodes are changed about every 24 hours to ensure proper conduction. So with our mechanosensor, you want to make sure that it is applied properly, as you will see the little finger. When you apply on, to make sure that the NMT has full contact, you're going to place a piece of tape in between the thumb and the index finger. When you apply the leads, you're going to on the ulnar side, and then you will place the white on top and the brown on the bottom. So you can think of it as snow on top of the dirt. At times, you may need to rely on the electrosensor when the patient is obese, or if they have poor contact in between the thumb and the index finger, or if the patient is third spacing and that is leading to the poor conduction, you will have to try to use the electrosensor. So to begin, you're going to set up the same way. So the white on the ulnar nerve, you're going to do your white on top of the brown, so the snow goes over the dirt. And then the next one you're going to move to is the palm, which is going to be your black. And then you're going to move down right below the thumb is your green, and then right on top of the thumb is your red. This will still give the response of your train of 4, or you'll have your 4 twitches. You can also utilize, if the patients, maybe they have an amputation or that there's not good conduction with the hand, you're also able to utilize on the patient's foot. When setting up the NMT on the GE monitor, once you plug your tram into the bottom and connect your cable, you will then see the NMT box appear on your monitor. As you click in, you want to ensure that you always start with a new patient. Your current is going to be set at 70 milliampage, and it's going to be a supra. Supra will start at the lowest impulse and work its way up until the patient receives the impulse of which they could feel. My stimulus mode is always on train of 4. My cycle time is always manual. We always want to make sure that we are at the patient's bedside when we are doing train of 4 and never leaving the patient by themselves. We will review pulse width. The normal pulse width for a patient is the depth at which the the stimulation is searching for that nerve. So for all patients, you want to make sure that you're on 200. If your patient is cold, you want to go down to 100. And then if your patient is edematous, go up to 300. So when your patient is all set up with the electrodes, and if you're using the NMT, the cord should be coming off of the patient's index finger. You can either select startup on the screen, or you can hit startup right on the tram. All right, now that the patient is set, we're going to hit the startup button. And then you're going to the patient will slowly start feeling the impulse. And the monitor is going to calculate feeling the train of 4. So with the results of our mechanosensor or electrosensor reading, there is a train of 4 is the count of detected muscle responses. So you will see your count of 4. When you have a train of 4 ratio, that's the ratio of the 4th muscle response to the 1st muscle response. So it all depends on what medication your patient is on. So if the patient is on a depolarizing agent such as SUX, you're going to see your screen with your bars equal across the top. If your patient's receiving a non-depolarizing agent such as Nimbex, ROC, or VEC, you're going to have a different slope of your bar, which is going to be on a downward slope. If the train of 4 is below 4, or if the ratio is less than that 10% of a TOF percent, you're not going to be able to see your goal. So you would just say that your patient is feeling 2. If your patient is fighting medication, you're going to see uneven bars. So the patient is not being paralyzed adequately and they're trying to fight the vent or, just fight against the medication. So for an example, for this, you'll have train of 4 of 61% of feeling that twitch from the 4th to the 1st. And the count was felt, so there's 4 out of a 4, but as you can see that there is an unequal graft off to the side. So that means that as I was taking this response, that the arm was moving. With your train of 4 results, this will allow you to know if you are titrating your drip up, keeping it the same, or titrating your drip down. And lastly, if the patient is not receiving any of the impulses, that we are turning the paralytic off and monitoring the patient extremely close until we start to see response again. Just make sure with your train of 4 that you're documenting it in your electronic health record and following the policy for the administration of an MBA.